Welcome to Between the Sheets, the non-judgmental podcast where we're going to cover various sexual health and wellness topics. I'm your host, Dr. Stephanie Zwonitzer. I'm a urology and sexual health nurse practitioner, and I love helping my patients and listeners discover and develop their most satisfying sexual experiences. Between the Sheets is here to normalize the conversations about sexual health and cover everything from basic anatomy to the most taboo topics and everything in between. Real talk, real pleasure, one episode at a time. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Welcome back to Between the Sheets. We are going to have a tough conversation today, but I think a really, really great one for some of our audience that deals with some tough stuff. And for those of us that haven't dealt with it, to be much more sensitive and aware of what's going on out there. So I have an amazing guest with us today, Dr. Andrea Liner. She is a licensed clinical psychologist, and she specializes in reproductive psychology. So she does infertility, fertility, IVF, and she's an IVF mom herself. So we're going to have a very interesting conversation today that hopefully opens all of our eyes up to this tough situation. Thank you for being here.
Thank you so much for having me. I think this is
Yeah.
a super important conversation to have.
Yeah, it is. I was a very lucky person, and I also got pregnant, in my early 20s. And I'm pretty sure that my ex-husband just looked at me and I got pregnant. So I did not have to go through this, but I have had friends go through with it. I have watched the roller coaster of emotions, and I am so grateful I didn't have to go through it, because I can't even express what I've watched these ladies and their husbands and everybody go through. So I'm really happy that we can have this conversation today, because I think not only is it important to shed light on it for those that are going through it and provide them with support, but for the rest of us, so we quit putting our foot in our mouth.
Oh my gosh, yes. It's so funny. I think half of my content is for the people going through it, and the other half is for the people who are supporting them, being like, please stop saying these things. Please start saying these.
Right. Yes. I mean, even in my own life, I have learned to, not just for IVF and infertility reasons, but just out of better respect, is like, you stop asking when are you getting pregnant? Are you guys having kids? Just because somebody got married doesn't mean they have to have kids. Just because they didn't get married and they're living together doesn't mean that they're not going to have kids, and so just let people have their own business.
Exactly. You just never know the reasons why behind whatever is happening is happening.
Right. And I sure as heck don't like it when I'm carrying an extra few pounds and somebody asks me when I'm due. So I would really like to not offend other people by asking them questions that are none of my business.
Perfect. I
So
appreciate that.
I'm learning. I'm learning as we go. So tell me, how did you specifically get into this area of psychology?
Yeah, I think I came to it the way a lot of providers in this space come to it, and that was my lived experience.
Mhm.
I've been a licensed psychologist for years. I've had a private practice since 2016.
Mhm.
And I've always done a little bit more of a general kind of adult therapy, people going through life transitions. For a while, I was specializing in relationships and breakups, which I still
Mhm.
do. But as I was going through what ultimately ended up being a 4-year fertility journey, I just realized that there wasn't a lot of expertise in this field. And that, while I have a lovely therapist who I adore, she hadn't been through this herself. And it's not that you have to have gone through what your clients go through in order to be helpful. But in certain situations, like IVF in particular, and
Mhm.
various branches of the fertility
Mhm.
process, there's so much information. There's like a whole new language. There's acronyms, there's terminology, there's a whole process to be mindful of.
Mhm.
And it was a little frustrating when I would have to kind of stop my emotions to explain what I was talking about,
Mhm.
because she didn't really know what it meant when, I was saying my scans were showing this and my levels were this and this drug and that drug. I had to kind of teach her a little bit through the process
Mhm.
in order for her to be as helpful as she could. And I realized I could be that for someone.
Mhm.
The person who already speaks the language and who knows. So I kind of shifted gears, not until I was pregnant. I think I knew I
Okay.
couldn't really do it. And there's a whole bunch of psychoanalytical theory that goes behind that too that I won't get
Yeah.
into. But once I felt like I was kind of on the other side, that's when I decided to get some additional training, go for
Hmm.
another certification, and just try to be this person for other people that I didn't have myself.
Yeah, that's amazing. So I didn't there's actually a certification for reproductive psychology?
Yes, it's
Okay.
called, and this is important too. So there's a certification called the Perinatal Mental Health Certification, or
Okay.
PMC. It's sponsored through an organization called Postpartum Support International, a
Mhm.
fantastic organization. And they have free online virtual support groups for like anything you could imagine in
Awesome.
the reproductive space. But one of the issues I've noticed with it is that they are postpartum support international. And a
Mm.
lot of the training involved and a lot of the people who come into this field come because of their lived experience through pregnancy and postpartum.
Mhm.
Not everyone has the experience of struggling to get pregnant or using additional treatment to get pregnant.
Mhm.
So, while yes, there is this designation that I think if you're looking for anything having to do with reproduction, pregnancy, postpartum, all of that, definitely look for someone with that
Mhm.
designation. That doesn't necessarily mean they have the training in infertility. And that's
Okay.
something I'm to speak to a little bit more, where I do think some people go to someone like that expecting them to speak the language already, and it's
Mhm.
a huge part of that designation right now.
Sure,
So that's
absolutely. Okay. Yeah, I mean, I think just in my own experience with my daughter, before I even left the hospital, I was ready to have another baby. Like, I just fell in love with being a mother immediately. And with my son, I ended up having postpartum depression. But as I'm listening to you, absolutely, what I experienced in postpartum depression had nothing to do with getting pregnant or being pregnant. I loved being pregnant. I thought it was the best thing ever. I had so much fun being pregnant. And so, yeah, I can see where you're saying you have to find the person who's right for the phase that you're in.
yeah. Yeah.
Okay, that makes
It's just
sense.
draining process too. So
Mhm.
like the less emotional labor you have to do while seeking support, the better.
Yeah. Yeah, for sure. Because 'cause you're already going to a bunch of appointments, especially if you're going through IVF and things like that. You're getting tapped out pretty quickly. Yeah.
Very much.
Yeah. So talk to me a little bit about your IVF journey, and then we'll kinda try and help other people as well.
Yeah. So mine was a long and twisty road. I kind of joke that there are different levels or flavors of the fertility journey and even the IVF process.
Mhm.
Some people, it turns out that they have a genetic condition they don't want to pass on. And so they
Okay.
go through IVF to make sure they test that out of their
Oh,
embryos and are not
interesting.
guessing something
Okay.
on. That's a use for it. Some people have what is kind of umbrella termed unexplained infertility, where there's
Mhm.
just like, there's nothing medically that they can identify.
Mhm.
Sometimes for those people, one round of an egg retrieval, one round of an embryo transfer, which are the two halves that compose IVF,
Okay.
and they're pregnant. For me, it was a lot. It was definitely not a straightforward process. We
Okay.
found out as we started to try, when we'd been married for a year, that was kind of our plan.
Mhm.
We discovered I had PCOS, which
Okay.
tracked, my cycles had never been super regular.
Mhm.
And some of those other fun symptoms. And I had a history of autoimmune stuff. So
Okay.
we suspected we might struggle a little bit, but you always
Mhm.
hope that
Right.
it's not going to be the case. Of course, as we were starting to try, a lot of our friends were starting to try, and people were getting pregnant left and right. And
Mhm.
I just knew the statistics, and I'm like, I'm going to be the damn statistic, aren't I?
Right.
And there I was. So I started, first I started going to a fertility acupuncturist, and then
Okay.
I think you need to get connected with a clinic. And I got connected. That's when I got my PCOS diagnosis. And
Mm.
then they said, well, with PCOS, sometimes the problem is just the timing of your ovulation or making sure you're ovulating. So let's
Mhm.
do some medicated cycles. Let's get you on
Okay.
letrozole, which originally was a cancer medication, still
Hmm.
is used for that, but it also helps induce ovulation.
Okay.
So they had me on that. They had us doing timed intercourse, which I'm sure you
So
talked about.
sexy.
Yeah, the hottest, most yeah,
Mhm.
process. We always want to do it at that exact time. We're always both
Obviously.
in the mood. There's no pressure
No
whatsoever.
pressure. Yeah, I'm sure your husband had no issues getting erections and, like, being ready to go right at that moment.
And it was so funny. I remember him saying to me, like, one time, he's like, "Andrea, I've spent 20 years trying not to do this. It's a real mind F to like suddenly
Right.
need."
Right. Yes.
Yeah.
"Put your
Yeah.
seed in me right now."
Yeah. So that was like not the most fun.
Yeah.
And then that's not working. So we move on to IUI, which is when, kind of the artificial insemination,
Mhm.
as I try to educate my boomer parents, the turkey baster method, if you will, but,
Yes.
not exactly.
But
Um,
professionally done, not at home.
yeah, right on. Which, another side note, really funny to talk to your parents about having a baby this way. My dad was like, I think it's a little easier for me to imagine you in a doctor's office. So thank you for that. We tried to do the process.
Right.
But do a couple rounds of IUI, and they say, we usually suggest 3 rounds of IUI before moving on. We did 2 rounds of IUI. I was like a super responder to the meds. We had 4 possible eggs one
Wow.
cycle. I had to sign paperwork saying, like, "We acknowledge the risk of multiples." Here's the whole
Yeah.
thing. Of course, me thinking, "Oh, great. We'll end up with 1 or 2 from this, no
Right.
problem." None of them fertilized ever.
No.
We move on to IVF, and they say, we suspect that maybe your eggs just need a little help getting penetrated by that sperm, and we can do that in the lab.
Okay.
So we start IVF, and it goes great at first. I got 24 eggs my first
Wow.
cycle, which is fantastic. Well, with
Mhm.
PCOS, I have a
Yeah.
lot of eggs that want to come out at once. So, and if you're not familiar with the IVF process, for anyone who's listening, there's quite a bit of attrition. There's like a big funnel. So
Mhm.
collecting 24 eggs does not in any way indicate 24 babies.
Correct.
Um, so 24 eggs, of those, I think 18 were mature. Your eggs
Okay.
have to go through maturation process. Some of them don't
Uh-huh.
make it all the way. So we were down to 18. And then I think like 12 actually fertilized. And then we sent 6 developed into that 5-day process that they then call a blastocyst.
Okay.
And they say, great, you've made 6 embryos. We're going to send them off to genetic testing. But with your age and these numbers, like, we were all very optimistic that this
Mhm.
was going to be the solution. 1 came back genetically normal out of 6.
Oh.
Yeah. So then we
Oof.
realized we're dealing with an egg quality issue. And
Mhm.
that, unfortunately, is something we can't know unless you physically take them out of your body and try to see
Right.
what they do.
Right.
So this is something that I think women are misled on, that if you get your hormones checked and you get your AMH, which is kind of your egg count
Okay.
hormone, roughly, and those look good, you're in good shape.
Mm.
If there's a quality issue, there's a whole other path you have to take. So we try another cycle, because if you want a chance at least one, if not more than one baby, you got to
Right.
have a few embryos
Right.
banked. So do it again. They say, well, let's go for quality over quantity this time. We collect 12 eggs. I don't even remember my numbers, because I can tell you that none of them came
Mm.
back usable. Both egg retrievals, I had the complication of ovarian hyperstimulation syndrome, which is when your ovaries go from the size of walnuts to like lemons, and there's tons of swelling in your abdomen, and it is
Yeah.
incredible. So,
Yeah.
just doing that twice and getting like basically no outcome. So then we decided, well, let's just move forward with our one. Let's just
Mhm.
see, maybe that's it for us.
Yeah.
And that embryo did not take.
Mm.
So then we were back to the drawing board, and my doctor at the time said, well, I think you need donor eggs. I think it's an egg quality issue. You can't really do much about your egg quality. You need donor eggs. And at 32
Mm.
years old, always wanting to be a biological
Yeah.
parent, pretty devastating to
Yeah,
hear.
that's a big blow. And then do you feel like you felt like your own body was failing you?
Oh my God,
Yeah.
completely. And it's funny, because going through anything like this as a psychologist, like, I can do all the mental gymnastics. I can do all
Right.
the coping mechanisms. I can recognize the unhelpful thought patterns. It doesn't stop me from having them in the first place.
Right.
So, of course, I'm feeling like a failure of a wife, a failure of a woman, kind of just a
Mhm.
failure of a human. Like, this is our whole
Yeah.
biological purpose of existence,
Right.
is to create the species, right? So just devastated and so overwhelmed. I mean, at that point, we did have some insurance coverage, but
Okay.
we're spending thousands of dollars, the blood, sweat, tears of it all.
Yeah.
And this time, just slowly, all of our friends are getting pregnant and having babies.
Mhm.
A few people were in a similar boat to me, but no one with quite as long and twisty of a journey as me. So I would have kind of buddies for a little while, and then eventually they would become pregnant. So anyway, long story short, I worked with a functional doctor. I worked on some health stuff, my inflammation levels, my blood sugar, all of that. I said to the reproductive endocrinologist, I think my egg quality should improve by doing these things. And she said,
Right.
I don't think so. So we said, well, let's go to a clinic that actually has some faith in us,
Right.
like has hope left, and actually has a lot better odds. And
Yeah.
family had been imploring us to move to this other clinic, and I was just too overwhelmed. But finally, we're back to the drawing board. So we switch clinics. That doctor says, I wouldn't tell you you need donor eggs. You've only had 2 egg retrievals. You only have 2 data points with wildly different outcomes.
Yeah.
Let's see what we can do. And lo and behold, 3 healthy embryos from that third egg
Wow.
retrieval. So in there, I had to go on a medically induced menopause for 3 months
Oh,
to calm down inflammation in my uterus. So that was thing. We found out I needed surgery on my parathyroid, which I didn't even
okay.
know existed, but some little thing that is behind your thyroid.
Yep.
I
Tiny
needed
little
that
thing.
tiny little
It
thing.
can really wreak havoc, though.
Thick. Turns out, yeah, I had high calcium for years. No
Oh,
one cared
oh,
until my doctor was like, well, why don't we just test your parathyroid? Let's just see. Sky high, got the ultrasound, benign tumor.
oh my gosh.
And come to find out, that can cause depression, brain fog. I was having a lot of that,
Yeah.
and infertility and miscarriage. So
Terrible.
great. So finally got all that taken care of. But all of this stuff, it punts your timeline down, down, down,
Right.
down. So yes, we did 3 egg retrievals and 2 transfers, but this was over the course of almost 3 years. It was like
That's crazy.
everything takes so long, the workups, waiting for the labs, the testing,
Hmm.
everything. Luckily, finally in April of last year, we had our successful transfer, and I now have a 9-month-old son,
Congratulations.
and we're considering kind of starting over for number 2. And
That's amazing. That's amazing. Well, I'm so grateful that it was successful for you. Not that you had, and I'm not grateful you went through this, but I'm grateful that because you did, you can help so many other people. I mean, I think that's just amazing.
yeah, I say, we always as humans want to make meaning of things, and
Yeah.
I'm not an everything happens for a reason person. I think there's a lot of horrible stuff that happens for absolutely
Yeah.
no reason. But a way that we can cope with horrible things is in hindsight, how can we make sense of this and how can we use it?
Yeah.
And I'm grateful that it put me in this direction. I never would have chosen this for myself, but if this
Yeah.
had to be my path, I am honored to help other people walk it who need to.
Yeah. Yeah, I think that's absolutely amazing. It's definitely an area that needs more attention. As I watched my friends go through it, as I'm listening to you, there are aspects of this that I have no idea about, right? I've gone through NP school, I've been in practice for many years, but this is such a niche part of
Mm.
medicine and of reproduction that the rest of us don't know about it. And so I love that you took your experience and are using it to help others because you understand those terms. And like you said earlier, you don't have to try and explain what you're going through, plus what the hell all these things mean.
Exactly.
Yeah, I
Exactly. It's
think
funny,
that's
one of
great.
my friends is OBGYN, and she ended up needing to go through IVF. And I would call her, we were kind of doing stuff at the same time. I would call her
Yeah.
with questions, and she'd be like, I don't know. I'm like, well,
Hmm.
you don't know? And she's like, we don't get taught this stuff. Like, I'm
Hmm.
learning. She's like, I know the
Yeah.
anatomy very well,
Right.
but I don't like
Yeah.
the procedures and whatnot, like the statistics, the outcomes. This is not taught.
Yeah. Yeah, it's not. It's not taught.
Mhm.
That's very interesting to me, and I'm just so grateful that you have your kiddo now and that you get to experience being a mom. My children are young adults now; they're 17 and 19, and it's a different phase of life. But I'm very grateful that I had my children, and I am very grateful they are now young adults. So good luck.
I know it's but this is the joke that, well, kind of wish that maybe I had done this a lot younger because, I'm 35, which is a
Yeah.
very small age to be a first-time mom these days. My husband's
Yes.
already 40 and we're like, "Oh crap, like when these kids are out of the house, like, oh my god."
Yeah. Good thing you had your fun earlier on. Like,
Right, that's right.
yeah, yeah.
So childish.
Yeah, I know. Well, I had no money in my 20s and then we had kids and really had no money in our 20s, but now I'm in my 40s and kicking them out of the house. So, I feel great about this. But it is. It's a
That's
it's a decision for everybody. And I am like a young mom compared to my kids' friends' moms. Like because a lot of people are waiting until their 30s and early 40s to have kids and
mhm.
or they get in situations like you where unfortunately it just takes several years to get there. And so, it is interesting to see people go through different phases of life with kids and stuff. So talk
Mhm.
to me about your practice. So somebody comes in, do they come in as the women? Do they come in as couples? How are you kind of helping people navigate this?
Yeah, so I used to do couples therapy. Turns out, don't love couples therapy, especially virtually, which my
Mm,
practice is all virtual.
yes.
Ever since COVID, it just stayed
Yeah.
that way.
Yeah.
So I have great referrals for couples if you need them, but that is not my bag anymore. I
Okay.
work with individuals, but I do work with men and women. My
Okay.
practice is predominantly women, I will say, but I do have, I currently have a man who's a single by choice parent going through assisted reproductive technology. I have, the husbands of who need support too. And I think, that would be a whole separate episode on
Mm-hmm.
how men ignored in this process and definitely
Yeah.
need more support. So I
Yeah.
do work with the men, but I would say 90% of my practice is women
Okay.
who are either struggling to get pregnant and just feeling
Mm-hmm.
stressed about it and want to just talk it through. It's adding strain on their relationship, the sex life, as we kind of
Mm-hmm.
noted earlier, or people who are pursuing fertility treatments
Mm-hmm.
and are in it, or a big chunk is pregnancy after infertility, which is a
Mm,
different because you don't quite fit into the infertility space anymore because
right.
technically, you're pregnant. And they don't want to hear your happy success stories while they're still in
Right.
it. So you're out of that space. But you're not really vibing with a lot of the mainstream pregnancy
Mm-hmm.
culture, like just all excitement and surprising people. In a lot of cases, the surprise element gets completely taken away.
Mm-hmm.
Like one of the things I grieve about my pregnancy is that I didn't get to surprise my parents that they were going to be
Yeah.
grandparents. This was such a long process. Everyone knew the exact dates of everything that was
Right. Right.
so there's kind of sadness around that and then just fear and anxiety because things
Yeah.
can still go wrong. And that's
Yeah.
something people don't realize about IVF is that it's not a guarantee of a
Right.
baby. Even if the transfer is successful, you can still miscarry for a
Mm-hmm.
number of reasons, even with a genetically tested euploid embryo. Um, Congenital things can still happen, developmental things can still
Mm-hmm.
happen. So there's a lot of fear because at that point, you're tens of thousands of dollars in and very high stakes. And not that people who become pregnant spontaneously feel like they have, unlimited opportunities and, oh, if we miscarry, we'll just try again next month. It's not like that at all. But in this case, when I have 3 embryos in the freezer,
Mm-hmm.
unless you go back to square one and
Right. Right.
do a lot then, like, you see your chances dwindle each time.
Mm-hmm.
So there's just a lot that goes into it. So a lot of my practice is that. And then the postpartum period where
Mm-hmm.
people still get postpartum anxiety and depression and OCD. And then they have a hard time reconciling that because there's parts of the process that are making them miserable, but they
Mm-hmm.
prayed for this, they paid for this, they wanted this so badly. And
Yeah.
just, oh, was biology right? And I really wasn't supposed to be a mom because I'm struggling.
Right.
So there's a lot just through the whole spectrum of the
Yeah.
process.
Yeah. And what's interesting is I didn't realize how tough it is to get and stay pregnant and to have a healthy baby, healthy labor and delivery, all of this for both the mom and the baby, regardless of how you got pregnant. It's tough. And I think because I was raised in a very wait until you're married and then sex is to have babies and those kinds of things culture, that wasn't talked about. Like you just assume that it's going to be easy and you're going to have kids because that's what you are, quote unquote, supposed to do. These are the roles in life that you follow. You grow up with your parents, you get married, you have kids. That is your life goal. And then I got pregnant easily. So then I never had any idea how
Mhm.
difficult and how miraculous getting pregnant and staying pregnant really is. It was
It
amazing to me to figure that out.
I everything I've learned through this process, I say this at least once a day to someone. It blows my mind that anyone is ever born.
Yeah.
It's
Yeah.
crazy.
Yeah.
I mean, everything has to line up, and then for someone in my position, it really blows my mind when it happens for people accidentally. Like, wow, because
Right?
everything has to line up
Yeah.
so precariously.
Yeah.
And and then it's funny because in this field, when you're trying, you're doing everything right. You stop drinking caffeine and you
Yeah.
stop doing high intensity exercise and you start eating this and this supplement. Da, 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 da. And then you find out, there's someone who's like addicted to drugs who eats, out of the trash can and they've had 6 healthy children.
Yeah.
And you're like, there's no rhyme or reason.
Yeah. Yeah. I completely agree. I have thought that so many times, and I'm not even in this world like you are. But yeah, I mean, you'll hear about somebody who randomly gets pregnant, and you're like, how the heck did that happen? And then you listen, like some of my good friends who have gone through IVF and struggled, and I've watched their tears, and you're like, but you're the most amazing person and you deserve kids. Like, gosh, it's just not fair sometimes. And
Mm.
even as a friend, sometimes I don't know how to convey I love you and I'm here for you because I don't get it and I never went through it, but I want to be there and I want to be supportive. So, what would you tell someone in my situation to kind of like, how can I best support without being offensive?
Yeah. It's a great question to ask, and I'm grateful that people are asking this question. It means a lot to those of us
Yeah.
who have gone through it that people want to be supportive in the
Hmm.
right ways. Number one, I think the annoying answer, and this is the answer that doesn't fit on a quippy little Instagram square. It depends. Everyone's a
Hmm.
little bit different.
Yeah.
So I would say the best first step, if you feel close enough to the person, like maybe not your high school acquaintance who you just happen to see her post about this, but you can ask and say, hey, I haven't been through this myself. I
Mm-hmm.
want to be supportive of you. What feels helpful?
Mm,
And be prepared for any number of answers. They might be like, I'm so overwhelmed. Like, I don't know. How can you even ask me that?
yeah.
And that goes back to it depends because you can have the best of intentions and do it exactly by the book and it's still not going to be right for someone,
Right.
depending on their plate. So just
Hmm.
that. But sometimes they'll say things like, you know what? I just really don't want to talk about it. Can we just pretend it's not happening? Don't
Mm,
ask about it. Bring it up unless I do. Let's just pretend life is going on as normal.
yeah.
Cool. Or, hey, I'd love it for you if you checked in every once in a while.
Mm,
It just depends on the person.
yeah.
I created a resource that I hope maybe we can send a
Sure.
link out or something.
Yeah.
I'm just working on, it's actually kind of like a checklist like this in different categories that you can kind of fill out. Like, I want you to text me. I want you to invite me to stuff, even if kids are there. If
Yeah.
kids are there, please warn me ahead of time, like that kind of
Mm,
thing that you kind of show to people
yeah.
in your network. But number one, ask.
Hmm.
Number two, and this is getting a big moment on social media. I've noticed a lot of people are talking about this, kind of the things not to say.
Mm,
Anything that starts with just or at least.
mm,
These are the so just relax. Just go on vacation. Just have a couple margaritas.
mm-hmm.
That's not helpful for a
Yeah.
lot of us in this. This isn't because we're like frigid bitches and like can't, like,
Right. Right.
there's something medically indicated here.
Yes.
And then at least, especially for people going through what's called secondary infertility, which is when
Okay.
you have a child or however many children, but you're unable to have the next child you want.
Okay.
Um, at least you have a child or someone who's had a miscarriage. At least you can get pregnant.
Mm,
These are not helpful things. So kind of
yeah.
nix, just and at least from your vocabulary.
Okay.
The best things you can just say are, "Ugh, that sounds really hard. I'm here."
Mm, yeah.
That's kind of the best. And I think a bonus point that I've been talking about more this week in particular with people for some reason, educate yourself if you can. ChatGPT is great for this. Hey,
Yeah.
ChatGPT, my friend's going through IVF. Tell me what she might be experiencing.
Hmm.
Find the process and timeline for me so I understand what it looks like.
What a great idea.
It's so easy these days to get
Yeah.
that kind of information. I'm working on a resource like that too, designed for providers, just kind of
Okay.
like a glossary index, like terms, like general timelines, just things to be aware of.
Yeah.
Uh, s- Something that I think people they ask questions when they're trying to
Hmm.
be supportive. My mom is like this. She was a journalism major. She loves her questions. And I know that in her mind, she's being supportive. She's like, I'm,
Hmm.
I'm being inquisitive and I'm being involved. It just feels like labor sometimes to have to like give you a
Sure.
fertility one lesson. So it's like, hey mom, can you do that, please?
Yeah. Yeah.
Oh,
I get
not
that.
super. Yeah. And the last thing I'll say on it is I'm a big believer in the platinum rule. So
Okay.
we've all heard of the golden rule, right? Treat
Hmm.
others who would like to be treated or do unto others as you would have them do unto you.
Yeah.
I like that in theory. I think that's the simplest way to teach it, like to our kids.
Yeah.
Would you like it if someone was pulling your hair? Okay, then don't pull their hair.
I
Okay.
mean, maybe just, but in the right circumstances.
Podcast.
Sorry. It's a sex podcast. I can't get away from it. You know what I mean?
So if they don't
Yeah.
want to be spanked, they do.
Right.
But as adults and with more nuanced, complex things, the platinum rule is treat others as they want to be treated.
Mm, okay.
So basically, and I'll use my mom as another example. God, I hope she doesn't listen to this because we got in a big fight about this one year. She's the kind of person she wants to be checked in on. If she
Okay.
has a doctor's appointment, it is like a love language to her that I remember she had a doctor's appointment at
Okay.
Tuesday at 3, and I'm going to call her after. How was your doctor's appointment? What did they say? What can I do? She loves that. And because
Okay.
she loves that, that's what she was doing to me.
Mm,
I felt suffocated and overwhelmed. I just would go like basically catatonic nonverbal after some of my appointments. I don't want to talk.
yeah.
And then I feel like I'm being a bitch.
Yeah. It's a
And it was
lot
a
to
little bit hard.
process.
Yes, yes. And in that case, she had a really hard time understanding why I was finding her to be unsupportive because in
Mm,
her mind, she's being so supportive. So that's, going back to ask them.
yeah.
Do you want me to keep track of things? Do you want me to check in with you? Do you want this to be part of our conversation? Because I'm an open book. I love talking about it.
Yeah.
But I know some people who are like, this is a little more private for me. And, you can let me know you're thinking of me, but that's really my boundary there.
I love
Good
that.
to know. Yeah.
Yeah.
And it makes sense. We always operate autopilot wise on what we
Right.
assume someone wants based on what we would want.
Right.
So I don't begrudge anyone of that, but I think it's kind of this cool next level thing we can do for people to recognize they might want something different.
Yeah, I think that's amazing. That's such a good point, and we can adapt that to many things in life, but especially to this situation for sure. So,
Mhm.
what are some of the biggest tips that you have for your ladies that are feeling like a failure? They're overwhelmed. How do they even start to process this and move? I mean, obviously we want them to come see you or someone in the same field as you so that they have somebody in their corner. But what are some
Yeah.
things that they can do while they're waiting for that first appointment with you or processing some stuff?
Yeah. Again, everything depends on the person. I'm going
Mhm.
to give some overall tips.
Yeah.
And if someone who's going through this is listening and is like, I would never want to do that, I hear you. It's cool. Take what you want, leave what you don't.
Yep.
One thing that helped me is I really leaned into what I called my pre mom identity.
Okay.
I didn't want to call it my childless identity or my infertile identity. I didn't want to identify with those
Yeah.
words. My pre mom identity,
I like that.
which was doing things spontaneously,
Mm.
sleeping when I wanted to sleep, not having to get home at any particular time, getting to plan a trip last minute, and things like that. I really tried to, when I was doing things like that, really take a moment and be like, I have this freedom and flexibility right now.
Mhm.
That's cool. Let's lean into that because I hopefully will not always be able to lean into that.
Right.
So that was kind of a fun mindset
Mhm.
shift that helped me out a little bit. And I even went a little further with it sometimes. And my friends with kids, I was a little jealous of. I'd be like, yeah, but they're up at 6 a.m.
Right.
Haha, sucks to you. Just to make myself feel a little better.
Right. Right.
That's one thing I think. Just lean into that. Also, with your partner, if
Mm.
you're going through this partnered and doing this single by choice is a whole other episode.
Yeah.
But with your partner, try to still have date nights, try to still
Mm.
connect. I saw someone talking on a forum about doing fertility free Fridays where
Okay.
they didn't talk about it and they, went out to dinner or played a board game at home or something to connect
Yeah.
outside of the fertility process.
Mhm.
And I think within that, we also need to be aware that sex becomes really laden
Mm.
when you're through this. Sex became something I actually kind of got mad at in this
Okay.
process. It was like, I didn't even, my sex drive plummeted, I was stressed.
Mhm.
I was depressed. And
Yeah.
like, it just felt like kind of a cruel joke a
Yeah.
little bit. So we weren't connecting in that way as much during this process. Also, there are points in the process where like you're not allowed to because of part of the medical
Right.
process. And so learning to connect with your partner in other ways and to
Mhm.
feel intimate and physical without maybe that actual sexual component is helpful. I also think saying some of these things that feel unspeakable out loud.
Mm.
Obviously, therapy is helpful with this. And sometimes therapy is the first place that some of these women say, I feel like a failure as a woman. I feel like I'm failing my husband.
Mhm.
I'm failing my family, not giving them grandchildren. Sometimes they don't want to say it out loud because you're kind of secretly hoping that it hasn't occurred to anyone else.
Mhm.
And if you say it, you're going to introduce this idea, and then they're going to be like, wow, yeah, you are a failure, and maybe I
Mm.
should leave. Some
Yeah.
the crazy, unhinged you'll have in the process. But I think it's really helpful. And it was helpful for me to have that conversation with my husband. I wish I had done it more intentionally.
Mhm.
Our that conversation came out after our first transfer failed, and I was in probably my lowest place. And I think I kind of yelled it at him, like, "You should just leave me and go marry some fertile myrtle who can do this for free."
Right? I can see that. I can see that.
And, that was kind of the popping the zit moment that needed to happen. It was
Yeah.
not pretty, it was a little painful, but we finally got it out in the open and started talking about it.
Yeah.
And he was like, "It breaks my heart that that's how you feel. And I don't see you that way." And I
Oh,
needed to hear that. And so
yeah.
I hope that for the women going through this, that your partner is telling you that. And if they're not, it might be because they don't know it's what you need to hear.
Mhm.
So
Yeah.
have some of those conversations, the two of you.
Yeah, and they're tough conversations. I would say one thing that this is not my realm, but maybe that I could contribute a little bit. In my world, I have a lot of patients who have erectile dysfunction. They need to take medicine, women who have pelvic pain, and we need to do warm up activities to get to where we can have sex. And so, scheduled sex is something that happens in my world frequently with my patients, and we coach them through that. So, one of the things that I talk to them about is date night starts in the morning. And so, in this situation where you have to have sex on a specific day and time because of ovulation and for best match, maybe we take a little step back and say, okay, yeah, I know it's scheduled, but let's face it, even when we were first dating, it was technically scheduled because that was date night and I didn't see you for 3 days. And so then I knew on that date night we were going to have sex. To me, it's always been kind of scheduled. And so texting each other sexy things, sending flowers, or picking up the favorite bottle of soda, non alcoholic wine, whatever you might be drinking during that time, because I know that alcohol is a problem sometimes. And so, whatever makes that day a little bit more flirty, a little bit more sexy, to take away
Mhm.
from that, this is this time that we have to do that. I recommend that to a lot of my patients, and it really helps with that connection part of it and that desire part of it instead of feeling so scientific and, okay, well, I took my Viagra, so now we have to wait an hour and now we can, okay, now you better be ready because my medicine's working and we need to do it now before the medicine wears off. Like, so I
Yeah.
kind of totally different type of, scheduling issue, but, similar. It might help just to kind of get over that little scientific part of it and bring a little bit more relationship into it.
Yes, I love that suggestion. Creativity
Hmm.
should be part of the process. And I also recommend, and I kind of know this was challenging for us at parts because of the mental component, but if indicated for where you are in your process and it's
Hmm.
allowed, have sex specifically because you're not ovulating.
Hmm.
Sex that really is just for the purpose of connection and fun
Yeah. And
can
pleasure.
be good. Yes, pleasure. And, I mean, I don't think anything's TMI on this
No,
podcast. Like,
definitely
I
not.
like to finish in different ways. Like, not
Yes,
everyone wants to finish by ejaculating vaginally.
correct.
And
In
and
fact, one
sometimes
of my friends, that was her husband's biggest issue with having to have, they were going through fertility issues. And he is a man who likes to see his ejaculate on his partner. It's fun for him. It's sexy for him. He likes it. And I remember having this conversation with them and he's like, I just don't want to ejaculate inside of her for once.
exactly, like, go have your fun. Go do it
Yeah.
how else you wanna do it, or engage in the other sexual practices you like
Hmm.
that don't make baby.
Yeah.
Because sometimes it feels like, "Okay, well, like, sorry, buddy, you're not getting a blowjob for a really long time because that's gonna be a waste."
Right. Right. Like we can't waste those semen, like we got to keep those sperm happy.
Make it fun, and there are so many you probably talk about this, so many games and toys and
Yeah.
things that can get fun. We bought a board game called Monogamy, and it's like a play on Monopoly. It's really funny. It has,
I
like,
love it.
different levels of spiciness, and you go around
Yeah.
the board, increases each time, and, like, it
Yeah.
was just kinda one of those things that when we were just, like, so monotonous,
Hmm.
shake it
Yeah.
up a little bit. It starts to feel very medical.
Absolutely, absolutely. I mean, even if you don't have the time or money, I mean, IVF is very expensive to go and buy a game. Almost all of us have dice at home. So go grab each of you make a list of what you would want if 1 through 6 came up on the dice and then, roll the dice and have some fun. Like do something different. I love that suggestion. Get out of the box and have fun when you're not actively trying to make that baby.
And a disclaimer also that if this season of life for you is just not lending itself to being
Hmm.
very sexy, to feeling very sexy, to connecting in that way, that is okay. I think that's something that can add to feelings of failure. Like, not
Yeah.
only is this not producing a child in the way that we want, but also I'm not feeling sexy. I'm not pleasing my partner. We're not connecting in that way. And then you
Hmm.
get in your head, how often should we be having sex? And is our marriage doomed? And there can just be all these secondary stressors
Yeah.
playing a role.
Yeah, definitely. It's amazing to me the level of connection and commitment and communication that you have to have in your relationship to go through something like this. And although that can be really tough, man, does that do benefits for you in your relationship going forward to have those levels of communication and that ability to sit there and talk and hold each other's emotions and things like that.
Absolutely. And I think it's funny. Sometimes people tell me, well, Andrea, if I go to you for therapy, what is that really going to do? Like, that's not going to get me pregnant. So, like, kind of what's the point? Like, what would we
Yeah.
talk about in therapy? I've had that question before. Great question. Usually people who haven't done therapy before,
Hmm.
because if you've done therapy, it's just kind of anything that's on your mind.
Yeah.
And I said, well, I'm guessing this is touching other areas of your life too.
Hmm.
And honestly, I'd say 30 to 40% of what I talk about with my clients is directly related to the process and the emotions involved in like the results you're getting and the things. I'd say 60% of it is relationships,
Hmm.
your marriage or partnership, your friends and family,
Hmm.
coworker things like social stuff that's getting tricky.
Hmm.
There's all these other layers to it. So the relational piece is very key and a big thing that I think talking to a professional can help with.
Yeah, I love that. Any other kind of wrap up things that you want to convey before we finish up today?
I would say, and again, this could be its whole other episode, but don't be afraid to, and again, this is a kind of a privileged piece of advice. I want to admit that, depending on health insurance coverage, finances, accessibility, if you have access, please do not shy away from getting second opinions,
Mm.
talking to other experts in this world, urology, endocrinology. I ended up seeing a functional doctor
Mhm.
before I connect a lot of the dots behind the scenes. Please don't shy away from seemingly alternative treatments if it
Mm.
can't hurt you.
Right.
If there's risk to it, we need to talk about that. But if it's something that sounds crazy, like I'm going to sleep with an amethyst under my bed because the crystal vibes,
Go
it's
for it.
not going to go for it.
Yep.
Have an open mind. You just never know.
Yeah, I love that. I love that. We will for sure put in the show notes how to get in touch with you so people can connect with you. I know you're on Instagram, so even if people don't end up getting therapy with you, they can connect with you on there and get some tips and tricks. I am just so appreciative for this conversation. This was so informational for me and just such a great conversation.
Thank you for having the conversation and
Yeah.
platforming this. And I hope that anyone who's going through this, please reach out. I also have a huge network of other providers and things. If it's not me you want to work with, like let's get you someone. You deserve support.
Amazing. Amazing. Thank you so much. Have a great week, everybody, and go have some fun between the sheets. Thank you for joining us and exploring sexual health topics here on Between the Sheets. New episodes are available every Wednesday. Please subscribe and rate our podcast so we can reach more listeners. And don't forget to tell your friends, partners, and anyone who will listen about Between the Sheets. Send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. It's all one word, podcastbetweenthesheets@gmail.com. Thanks for listening and go have some fun between the sheets.